Hey guys, this is Troy. I'm a PA with Advanced Age Management here in Medina, and I'm with Dr. Coca, Dr. John Coca.
Hello everybody, how are you?
So you may have seen some of our podcasts before, maybe even the radio show. We were on WTM, TAM for a while, and we were doing a lot of these Facebook Live feeds, and we were doing the radio show. It was out in the mornings, things like that, and we decided to just kind of get back onto the Facebook Live here and talk a little bit about men's health, low testosterone, andropause.
Yeah, sure have. Had a lot of fun on the radio, huh?
The radio was a lot of fun. A lot of men really enjoyed that thing.
They did, yeah.
And I think we'll get that started here again in the near future. But first and foremost, we'll just get started with some of these live feeds here on Facebook.
Yeah.
And if you're looking for us, you can always find us. Just real quick plug here. You can go to lowtohio.com. You can also contact us directly. You may see on this Facebook Live feed that there is a free low T assessment. You can contact us directly, 330-242-7669.
Yeah, sounds great. As you can tell, if you've seen any of our other videos or our radio show, Troy and I are extremely passionate about this kind of medicine. This is where I've really specialized in the last 14 years of me being a doctor. Actually, it might be more than that now, but 14 years of doing age management, preventive medicine, precision medicine. There's a few ways to, different labels that we can use to describe this kind of medicine, but really it's about making people feel and function better in a safe and effective manner. And as anyone that listened to the radio show, I'm a big proponent of doing this in a very safe medical manner. I do not have respect for practices that do this incorrectly. And it has to do with the evolution of this kind of medicine and making sure that it is appropriate, and we respect guidelines, we respect health. But it's something that's very effective when we optimize hormone. When we optimize hormones, we fine-tune nutrition, fine-tune exercise, coach people with lifestyle, and use certain evidence-based supplements or medications. The program is not the same exactly for everybody. We certainly use some of the same hormones and maybe some of the same meds or supplements and guidelines with nutrition and exercise, but it's also a bit customized, right,
Sure.
Troy? I mean, we don't do the same thing. And we make sure that we listen to the patient. This isn't a cookie cutter program. This isn't something where we have age management counselors that don't have much training that basically just fill orders. I don't like those kind of programs. I'm a medical doctor. Troy's a very highly skilled, trained PA. This is a medical program. If you're not sure what you're getting into online or with some other program where someone talks to you, come here, because I guarantee you we're doing this the right way, the safe way, and the way that other doctors would want it to be done.
Sure. Yeah, and if someone's out there listening, they go, okay, this is interesting. What's the ideal, would you say, quote unquote, patient, or what would someone out there that's listening go, hey, okay, this is something I've thought about, and there's kind of this misconception, I would say, that low testosterone only has to do with like erectile dysfunction or bedroom activities,
Right.
but it's not.
Absolutely.
And it's a quality of life issue. So if there's a patient out there that's listening and they're out there, what would you say? Hey, here's the common signs and symptoms that we see that you might benefit from in a program like this.
I think one of the questions is, are you feeling older? Do you not feel like yourself? I think that's something that people come in and they say to me and to us all the time. Common symptoms would be lower energy. You don't feel as energetic. Maybe you need occasional naps, or you don't have the drive and motivation that you used to get some extra things done. You're not as driven in your work environment or your home environment to take on new projects. So energy being low, drive and motivation being low, more aches and pains. You feel a little bit more stiff. You get more achy after a workout. Workout recovery, exercise recovery, not as fast. It's one of the rate limiting things that happens with competitive athletes, whether you're a hobbyist or you're a pro athlete or amateur athlete. The folks can't repair, their soft tissues don't recover as fast. You can't train as hard. You can't train as frequently. And again, you're more susceptible to things like tendonitis, tendinosis, tears, muscle strains, muscle tears, things like that, degenerative joint issues. So recovery, there can be a reduction in sex drive or sexual performance, but it's not an on and off switch, and it's certainly not the most important thing, in my opinion, with patients thinking that they need to have that to come in. Absolutely not. I would say body composition is huge.
Sure.
There's this thing about the man bod. Listen, there's nothing sexy about the man bod and the dad bod or whatever it is. So it's just people are getting their metabolism is slowing down, their hormones are changing. You're developing, the fat in the lat area, in the lower pec, abdominal obesity certainly, which raises our risk of cardiovascular disease, cancers, diabetes, metabolic syndrome. The same things that in family medicine we tried to do. The same symptoms. I mean, things that we see in guys that happens really, in your 40s and beyond, where the body changes. But certainly things with hormones can help. We can change the metabolism. We can change some of the fat distribution. We can add some lean muscle. No, it's not to the extent of a bodybuilder necessarily that's abusing steroids. That's not what we do. But we can get, with hormone optimization, a better response to exercise, meaning more healthy lean muscle mass, a faster metabolism, less body fat, less abdominal body fat. So these are some of the things. I think you and I mentioned quite a bit too. Mood and mild depression.
I think that's a big one.
Yeah, in medicine we call it dysthymia, just kind of like the blues. Some people have seasonal depression. They just don't feel as happy as they used to.
Sure.
And I see that quite a bit in patients. And my first suggestion is not to put them on a Prozac or Paxil or Celexa. My solution is, check their hormones, check their thyroid, check their testosterone. Certainly we'd rather do things that you're not subjecting people to medications and things as such with the neurochemicals if we don't need to. I mean, if there's root causes, let's fix them. Let's look at their lifestyle. Let's look at things like with hormones, of course, and exercise and nutrition, because there's a lot we can do for mood with that. But the blues. So if you're kind of just glass is half empty, not half full, that would be another symptom. So those are some of the common symptoms that we see. We see people mostly 40 and older because these are the common symptoms. At least these symptoms are more common in that age group and are more likely to be associated with hormone and metabolic changes. Although there are some patients in their 30s, especially between 35 and 40, where we've both seen quite a few folks crop up. So we don't want to discourage those folks from calling us either.
Sure.
In some cases, we might require an endocrinologist to take a look at you before you see us, but otherwise we're open to treating anybody, especially people that have maybe been not seen by their doctors or sort of just kept at bay because they doctors don't know exactly what they're doing. A lot of doctors also, they look at this as, I'm not sure what I'm doing. This sounds like it might be performance enhancing, and I'm just, you shouldn't do that. Or the old myths where testosterone may be associated with things like prostate cancer, which is not correct. And I have 10 years of research reference if anyone wants it. But these things prevent some family doctors from getting involved. And we would really reach out to you guys, family docs and allied health professionals. If you're not sure, don't opine. Don't give information that might not be correct. Refer to someone like us where we can adequately assess, screen, and treat your patients.
Yeah. And I think that, a lot of guys out there, they've maybe seen their family doc or seen some other people and get frustrated because they go, well, they checked some blood work and said nothing was wrong.
Sure.
We see that all the time.
Yeah.
But really the easiest thing to do is if you're out there and you're listening to this and you go, gosh, I've been curious about this, or hey, remember one guy when we did the radio show said, I listened to your show and it was like you were talking right to me. If that's you out there, easiest thing to do is just come in and get screened. It really is the easiest thing to do is just start with a screening is, just get a hold of us, go to lowtohio.com. You can check us out there. You can give us a call and set up an initial screening. You'll meet with Nick, he's our program coordinator. He'll be meeting with you, going through your health history, he'll draw blood, and then you'll meet with one of us, and we can figure out what to do or where to go based on what's going on here. So.
And we're a team here, so we bring all of our expertise in, and we look at the blood work together, we chat about all of our patients, we chat about the patient plans and, the medical plan, the medical program. But to mention just real quick about the labs, we do a very, very robust and comprehensive screening. It's like an endocrinology office and a preventive medicine family practice. It kind of all in together. So it's a very large, it's an encompassing blood work that gives you a lot of information about you and your health. And we're going to be looking at things that your family doctor is not going to usually test, as in, not just the total testosterone, but the free testosterone, your luteinizing hormone, your sex hormone binding globulin, your prolactin, your other comprehensive thyroid panel, and these other things that we're looking at to adequately assess, because the reference range does not tell the whole story. The reference range, if you're someone that had normally high testosterone when you were younger and your body was used to that, and you're at a total level of 900 and your free level is at 26, and you drop to 400 or 4 something and your free level is 13, this is someone that you're going to feel it, and that we would still have a conversation with based on their symptoms and appropriateness of the therapy, but we may be more open because we're open-minded to it and understanding that the reference range is a guideline, and we respect that guideline, but we're not going to wait till someone is below a very low reference range because it's already a critical deficiency.
Well, as always, the time in these little segments goes so fast. So our 10 minutes is up. But if you are interested, first thing to do is just visit www.lowtohio.com, so lowtohio.com, or contact us at 330-242-7669. And just before we sign off here, final thoughts?
Don't be afraid to call us, guys. There's really no obligation whatsoever. We want good patients, and we'll answer any questions that you have. So we make it as simple as possible to get in here and get screened. We want to do this right, and we want to help you guys. So thanks for listening.
Stay tuned, and we'll see you next time.